Hi YouTube, it's Kim. Today is Saturday, April 2nd, and I will be on Monday 15 weeks post-op. I know I said that I would get you guys some before and after pics, and I will definitely be doing that. I just need to get them all put on YouTube and figure out how to do that. So hopefully I can get that figured out by tomorrow and have that up for you guys. I only lost 1 pound this week. It's fine. Everything was normal. I don't know. It was just 1 pound, and that's okay because that makes it 74 pounds in 15 weeks. And you know, I've already getting some loose skin. In fact, you know, I don't have a full-length mirror at home, and that's because of the whole, you know, I call it fat girl syndrome. You know, if you don't see it, it wasn't there, and whatever. So I need to get one. But anyway, so I was at work where we do have one, and finding some new spots that are loose skin, like the sides of your hips, the outsides. Yeah, wrinkling, yummy. It'll go. I'm not worried about it, but it's just a weird spot that I found that had extra loose skin. I actually had a wonderful week this week. I visited my surgeon on Tuesday, and so it was the first time I've seen him since 2 weeks post-op vertical sleep. And it was funny because, you know, he had originally, like I told you guys, had said that he saw me at 200 by the time everything was done, and I had a goal of 180. You know, I have no desire to be skinny. I don't know that I would even look good skinny. I just want to be healthy and happy, and you know, my mind is healthy now. My body is getting healthy. Things are really changing with, you know, like joint pain is gone, sleep apnea is gone. I mean, I've mentioned these things as non-scale victories quite a few episodes back. So, you know, I'm very, very happy with how things are going, and so I had brought up to him, you know, I call it a kangaroo pouch. It's the lower part of the stomach, and it hangs over. I've had it, I don't know, since I was probably 12 or 13, it started forming, and it's always been there. And I've always just, you know, even as a kid, you hold it, and you're like, can't you just take this off? And I'm still thinking that way. And so I had asked him when I could start talking to plastic surgeons. You know, in the past they had told me 12 months to 15 months, and being at 74 pounds gone, which my scale, by the way, matched their scale, and my BMI matched with what they came up for a BMI. So I had asked him, you know, when I could officially actually start looking at plastic surgeons, and he said, well, at the rate that you're going, I would say at your 6 months post-op, if you're at 100-pound loss and it's been kind of a steady 1, 2 pound, 3 pound week, nothing huge amounts, then I would probably go ahead and recommend it for you. So that was exciting. To get rid of that and make pants fit so much better, I cannot wait. Not to mention lower back pain will be going away, and you know, just stuff like that. So it was a very positive doctor's appointment. I have never left a doctor's office and not had anything negative. You know, even leaving a dentist, you got a cavity, it needs to be fixed, or you know, get tartar or whatever, you know, it's negative. You go to a doctor's office, or I did, and it was, you know, your blood pressure's a little high, or you're obese and you need to lose some weight. You know, this will make your joints better. It didn't matter which doctor I went to, it always came back to, you're fat and you need to lose weight, and these issues will go away. And you know, it was just always negative. And this visit with my doctor, nothing negative. In fact, you know, the nutritionist, she was pleasantly surprised. She said, you know, I am losing weight a little fast, but nothing alarming. Don't worry about it. They did blood work. guys, my protein was normal, my vitamin D was normal, HCG was normal. I mean normal, like normal people normal. And the protein especially kind of shocked me because honestly I don't do the shakes and I have a really hard time dealing with that protein stuff. So I have always, well, in the last 5 weeks or so, I have always decided meat or protein of some sort first, and then if I've got room after, then, you know, whatever the side is. So I've just been really staying on top of that part with the protein. So I was really happy to hear my protein was doing really well. So all my blood work came back perfect. And she isn't making me change anything. She isn't upping any of my vitamins or calciums or anything. Nothing has to change. And if at 6 months I'm steadily staying the same, then I should be able to get off the extra stuff and just be on vitamins twice a day. So that was cool. And the doctor visit, you know, I already told you about the surgeon area, but it was just nice to hear nothing negative. I left there smiling, like ear to ear smiling. It felt so good. And he gave me before and after pictures. Okay, they had an intern there back in 2010 when I first started this journey, and she had taken a picture. Well, it got lost in La La Land. I don't know if it got erased. I don't know what happened to it. So I was kind of bummed that I didn't have that to go by. But I originally had started looking into this process back in 2000. What? Oh, that's the light in the background. Originally started this process back in 2006, and very discouraged because my insurance at that point was clause of life-threatening. So couldn't get it then. So I had a 2006 picture and then this year's picture, which was taken on Tuesday. Okay, first off, I don't know what was up with that hairdo, and for those who I talked last week about with the hair and Facebook and check out pics, there was a cute pic that everybody, well, 90% of the people had chosen. It was a shorter haircut. After seeing this 2006 picture, nope, not happening. So it was neat to see the before and after, and unfortunately in 2006 that wasn't my highest. So although it was dramatic change, it's not as dramatic as what would have been last year. So I have to go on a hunt and find some pictures and post them. I don't really have anything else too much to say. Everything's just been really, really good. You know, I don't know if I mentioned, you know, I have 2 nieces who are have celiac disease, and so they're on a gluten-free diet, and you know, they kind of mentioned that it's a really healthy diet anyway, and it's been coming up more where we, you know, have company over, or just my family wanting to have pizza or, you know, something out to eat, and I still struggle with doing that. And so we had this pizza issue come up, and we have a local pizza place called Happy Joe's, and they just recently got gluten-free pizza, and so I thought I'd give it a try. And the crust is so much different as far as thickness and texture. To me, the flavor was the same. I didn't notice. I actually would prefer to have the gluten-free, and their pieces are really small because they only come in a small anyway. And it felt so good to have one small piece of pizza, and it tasted wonderful. I didn't have any issues whatsoever. I did try to have a leftover the next day, too thick. That's alright. Anyway, my time's about to come up, so I'm going to have to let you guys go. But anyway, if you're interested in trying some gluten-free products on your stomach, they work really well for me so far. So you guys all have a wonderful Saturday, and I will try and get all those pictures uploaded tomorrow. So bye, guys.